Hi everyone, welcome to researchonly.com. We got a great presentation today. Today we've been doing a lot of, series of lectures on GI diseases. So we did primary biliary cirrhosis, primary sclerosing cholangitis. So today we're going to start with the cholelithiasis. That's our topic, okay? So what is cholelithiasis? Somebody tell me what's the definition? What is the definition?
Presence of stones in the gallbladder.
Okay, if you can say that, in the best definition, say right here, presence of abnormal concretion in gallbladder. Okay, based on what? There's two types. One is cholesterol, and the other one is pigmented. Remember, so pigmented you can divide them into black and brown. So it's let's look at the definition: presence of abnormal concretion in the gallbladder, right? Could be cholesterol, that's the majority of the stones, and it could be the other one, brown and black pigment stone also. Remember, that's our definition. Okay, everybody got that? Now, so if you look at epidemiology, just remember females it's more. Okay, that's the number one. Etiology, got somebody tell me what are the causes?
So we have a mnemonic, Dr. Cheriyath. It's 4 F's, fat, female, 40.
Yeah.
So that would be much more easier to remember, I think.
Okay, so you want to repeat that again?
Fat, female, 40.
Never ever say that. Okay? When you say fat, be very careful. That's not a very professional term to use.
I'm sorry, Dr. Cheriyath.
Okay, I was waiting for you to say that. I've seen people all the time do not use the word fat. Okay. So just if you are a professional, so always trying to say in the BMI.
Okay.
Okay, obese or those kind of things. So I would say start with the BMI greater than 30. Okay, and then 40 female and fertile. Then you can say pregnant female is very high, right?
Right.
And the drugs vibrate or contraceptive pills also. Got it. Okay, malabsorption, inflammatory bowel disease, Crohn's disease, I think around 10% of them can have gallbladder stones. Okay, so when you look at it, what are the clinical features? Somebody tell me what are the features? What do they usually present it? Somebody have gallstone.
Right upper quadrant pain.
Not all of them. Most of them remains asymptomatic, right? And all of a sudden sometimes they can have it, but majority of the time they remain asymptomatic. Right upper quadrant pain. How long? The hours. What is the thing we have to look for?
Less than 6 hours.
Less than 6 hours. It's more than 6 hours. The longer term, then you have to think about acute cholecystitis or something else going on, right? What are the other things? It may radiate. Where does it radiate to?
Right shoulder.
Right shoulder, okay. And then nausea, vomiting, early satiety, bloating, dyspepsia, all of that, okay? Remember, one thing you have to remember, most of them remain asymptomatic. Right upper quadrant pain, remember the 6 hours, and remember radiating to the shoulder. Where? Right shoulder, right? Okay, now, this is where the money is. We need to know about the pathophysiology. Okay, if you know this, I think you get everything about cholelithiasis. Okay, so we can just going to go 3 different stones. How does it form? So main thing usually what happens is there is increased cholesterol. Okay, plus what is the other one? Gallbladder motility is effect, decrease in motility of gallbladder, okay? So this, what does this do? It's contribute to increased cholesterol. This is what happened. One of the causes over here, when you said BMI, what is the BMI 40? They become what? Metabolic syndrome, right? So there is increased cholesterol, usually with the phospholipid and the bile salts, it from the soluble biliary cholesterol and then get it absorbed. That's what the normal mechanism is at. And usually cholesterol is in kind of unilamellar shape. Okay, so what happens is mainly the situations kind of become pathophysiology, right? From the normal, now we have to go to abnormal. So what happened to the abnormal? What happened to the cholesterol level?
Increases.
Increased cholesterol. What happened to phospholipid?
Decrease.
And what happened to the bile salts?
Decrease.
Decrease. So there is decreased phospholipid, decreased bile salts, but increased cholesterol. And then what does this form? Unilaminar become multilaminar, okay? And then this multilaminar, there's a process called a nucleation process kind of going on. Mainly with the mucin is produced by the lumen and the calcium, they combine, and then you got cholesterol monohydrate crystal, they form microlith, and then you got the gallstones. Also remember, when you have apolipoprotein and lecithin, they inhibit this, usually that's a normal process. If this is also decreased, you can have cholesterol stones. Remember that, okay? So remember the pathophysiology. You got the, decreased phospholipid, decreased bile cells, increased cholesterol. From unilamellar, usually that can convert to a multilamellar nucleation process with the help of what? Mucin and the calcium and calcium monohydrate crystals. Then you got the microlith formation. Everybody got that, right? Now we talk about the pigment stone, okay? We told already, what are the two types? Somebody say that again?
Black and brown stones.
Black and brown. Let's start with the black. What is black? There is like chronic hemolysis. One word you have to remember is chronic hemolysis, okay? When you have chronic hemolysis, what happened? You have like increased unconjugated bilirubin. They combine with the calcium. And then what happened? Calcium carbonate stones and calcium phosphate stones. Like if I'm writing a question, like what happened to sickle cell anemia, it's always hemolysis, right? I write a question about sickle cell anemia patient coming with a black stone. That kind of like a beautiful question. I can put a story together, remember that. Okay, so black stone, remember, and then brown stone, what happens is like, remember, in the black stone, it's always very clean, sterile. Okay, when you have brown stone, what happens? There's infected bile. What does that mean? There's an infection. Okay, there's chronic anaerobic infection, functional sense of the bile duct. And what does that produce? That what happens is in this conjugated bilirubin is converted into unconjugated bilirubin by beta-glucuronidase. And that unconjugated bilirubin combined with the calcium, and you got calcium bilirubinase stones. Okay, so everybody got like the formation. We get everything in the pathophysiology, then you remember this forever. That's why you spend, we wrote this beautiful diagram and all the process. Just kind of, if you want to watch it again, please do how the pathophysiology, how does it form a cholesterol stone, black stone and brown stones. So the patient come in, what investigation would you do? What happens if you do an LFT? What is that?
LFTs, so
usually like normal, right? If it is increased, then you have to the other causes like CHOLELITHIASIS and cholecystitis, those kind of problems. Usually like LFTs kind of remain normal. So it doesn't kind of give us a clear picture. So what are the imaging studies we have to do? Ultrasound. That is like, look at the sensitivity and specificity, my friend, right? You got almost like a 95% sensitivity and 95% specificity. So pick an ultrasound, and then how do you treat it? Let's say if somebody obviously did like an ultrasound for something else and they found out stones. Did you do anything?
No.
Asymptomatic? Leave it alone. Okay?
Yes.
Remember that. And then asymptomatic and immunocompromised people, there's increased risk of, what do they get? What does that say?
So,
asymptomatic
or
if it is asymptomatic and if they are immunocompromised, there is increase of gallbladder cancer. So take it out in that situation. Everybody got that? Okay. Now, then you have like, symptomatic. If it is symptomatic, you do like, very simple procedure, laparoscopic cholecystectomy. You can go in and out. No big deal. Medical treatment, let's say somebody said like they don't want to get surgery done, right? In limited population, there's a role for ursodiol. That is how to dissolve the gallstones. It doesn't happen all the time in some kind of people, but it doesn't, the symptoms, it does not relieve the symptoms. Remember that, okay? So what are the complications? Oh God, somebody tell me what are the complications?
Cholecystitis.
Acute cholecystitis, and then you have to think about surgery, right?
Yes.
You can call it cholelithiasis, the stone causes the common bile duct, which will make another presentation. Acute cholangitis because you got fever, you got the triad, right? And then you got empyema, fistula, gallbladder cancer, and all that. Doesn't usually, I think very rarely it can convert it into very rare circumstances you can have gallbladder cancer. And how do you prevent it? Always healthy diet, right? Decrease fatty food, increase fiber intake, and also take vitamin C. It will help you to prevent. Okay? To summarize, so we're going to go over a little bit. You got three types. One is cholesterol, and then pigment stones kind of divided into black and brown. Right? And think about the BMI. Remember, it's more common in females. Remember the BMI, role of all contraceptive pill, and then always remember this Crohn's disease. Okay? That's like if I'm writing a question about an examination, I definitely write that. And then remember, most of the time it remains asymptomatic. Remember the 6 hours, and remember the pathophysiology we talked about. The role of increased cholesterol, decreased phospholipid, bile salts, and the nucleation process, cholesterol monohydrate crystals, And the pigmented stone, you talk about black, which is sterile, right? Hemolysis, kind of sickle, think about sickle cell anemia, and then come to brown means infected. Okay, that's where anaerobic infection, you got calcium bilirubin stones, always pick ultrasound with highest sensitivity and specificity. Asymptomatic, don't do anything, but immunocompromised, take it out. Symptomatic treatment, cholecystectomy, and the medical treatment, limited role always. Don't pick this as the first line treatment. Got it? And then look about all this all these complications we talk about it, and prevention, healthy diet, vitamin C has a role. Thank you so much for watching, my friends. We'll be back with another presentation. Please subscribe to our channel. Thank you.